All right, our last video is going to wrap up the last few injuries that we'll talk about with the hip. The first one that we're starting on today is going to be referring to osteitis pubis. Okay, we always talk about recognizing words. So remember, anytime that we see itis, that's referring to inflammation of something. Okay, we automatically know inflammation. And we see pubis, and we already know that we have that part of our pelvis. So this is specifically talking about one part on the pelvis that has become inflamed. It's become irritated. So our mechanism of injury for osteitis pubis is repeated stress on specifically the pubic symphysis, okay? I know we haven't really talked a whole lot about where this is, so I'll show you on the next slide, but it's going to be where our two pubic bones connect, okay? They're connected by a little tissue, and that's our pubic symphysis, okay? Signs and symptoms, lots of pain in the groin area, okay, the very, very medial leg, all right, very point tender. There's going to be some things that are more uncomfortable to do, such as running, sit-ups, and squats, okay, and that just has to do with the motion that occurs on our pelvis, because anything that's causing this area to kind of move more than others is going to be what's causing irritation. Just like with any inflammatory condition, rest and anti-inflammatory meds are going to help you a lot, okay? Big thing is gradual return back to activity. It's not let me sit out for a week and then just jump full back in and hope that everything is perfect. It usually will come back and it not be fully healed to begin with. So here's where we're talking. So we have our two different sides right here of the pelvis, and they're connected in the middle by this little bit of tissue, all right, the pubic symphysis, all right, and that area is red, inflamed, irritated, okay, and that's what this condition occurs, okay. I will say the 6 years that I've been with Louisville, I don't think we've had anybody that has had this condition, but it's one of those things you do need to be mindful of, especially in athletics. Our next one is a stress fracture of the pelvis, okay? It's going to be less common than a stress fracture in our foot, ankle, lower leg area, but definitely can still occur, okay? Just like any other stress fractures that we have, repetitive, abnormal use, going nonstop, too much training, maybe not on the right surface kind of thing, is going to have this occur. Our signs and symptoms are going to be similar to any other stress fracture. We're just dealing more with the pelvis area rather than our lower leg. Remember, we're going to need that bone scan to help determine if we have a stress fracture. X-ray is not always going to be best diagnostic tool, especially in the early stages. So you'll want to send them to the doctor, and then they will have to rest the area. So here's our bone scan right here. Here's our spinal cord. Here are our two different sides of our pelvis, and this increase in the black area is going to show the added stress to that pelvis area, and that's where our stress fracture is going to be located. And you can see, especially because everything should pretty much be even on one side and the other. So you still have this up here and you have this part up here, but this area is not on this area. Your body's kind of made in pairs, so when you see something on one side that's not on the other, chances are there's something going on. Our next injury is an acute fracture of the pelvis. So we just had stress fracture, which is going to be more chronic long term, and now we're going to talk about the acute. So it happens immediately, going to be caused from some blunt trauma. Our pelvis is very, very strong, okay? Just like when we talked about with hip dislocations, it takes a lot of force for this to actually happen. So it doesn't happen a lot in sports, but it is not one of those that never, ever, ever happens in sports. So we're going to just cover it really quickly. Our mechanism of injury is going to be direct trauma, okay? being hit really, really hard. Okay. If you're falling from maybe, like I could see like a high jumper going and maybe they miss the mat or the pole or a pole vaulter, that could happen. Signs and symptoms, they're going to be in a lot of pain. Okay. Unable to really move our lower legs. Okay, especially depending on where that fracture is. And shock can occur. We're breaking a super strong bone in our body. So anytime we do that, just like with the femur, shock is going to be something that we're going to be very concerned about. And so not only are we worried about taking care of the fracture, but we're also worried about taking care of that shock of the victim as well. So we're going to be sending them to the emergency room. Okay, calling 911, have them transport, because it is a medical emergency. So here's our pelvis right here. Okay, there's an x-ray of our pelvis. So we just saw on Osteitis Pubis that these two parts right here of our pubic bone are supposed to be close together. They're supposed to be just touching, connecting by that pubic symphysis. They are no longer connecting. Okay, they should not have that big gap there. That is where this guy has fractured. Not a good thing to have. So because our hip and pelvis is made up of irregular bones, but they're very, very flat, we have a lot of muscles that attach on different parts of it. So anytime we have a muscle attached to the bone, we kind of always have to think about avulsion fractures. And unfortunately, the hip is not a stranger to avulsion fractures. So remember, an avulsion fracture is pulling away of a ligament or pulling away of a tendon from the bone. Okay, and with the hip, we're going to see it more times than not, the tendon and the bone, not the ligament and the bone. So our common areas where this is going to occur is the ASIS and the AIIS, as well as that ischial tuberosity. Okay, remember when we're looking at the pelvis, there's those different points that kind of stick out a little bit. Those are these. Okay, remember our ischial tuberosity on the posterior side. That's where those hamstrings attach. Okay, anterior, inferior. Iliac spine, that's where we have that rectus femoris attaching. Okay, so big muscles that we need and we use a lot. That's where we worry one of the things about dealing with these avulsion fractures. So signs and symptoms, localized pain. It's going to hurt. Whatever muscle you have just removed from its attachment, that patient will be unable to perform that motion. Okay, we had a soccer player a couple years ago that one of his hip flexors popped off. He had an avulsion fracture, and he could not flex his hip to save his life. Okay, you've severed that attachment. It's not going to work. That rubber band is no longer attached. So our treatment for this area, it's going to depend kind of on what you're dealing with, but rest is going to be a big thing. You are going to refer them to the doctor and make sure that there's nothing else going on, but they're going to have a slow return back to activity because they're going to have to get that tendon and that whole entire complex to heal, especially if you're trying to get them back into a contact sport. So I know this isn't the greatest picture that you can see, but we do have a little bit of an avulsion fracture right here. This is our lesser trochanter on our femur. We have pulled off a piece of that bone right there. Remember, an avulsion fracture can occur between a tendon or a ligament, but it always includes a bone. And that was our last injury for the hip. Okay, I know it was a lot. You guys have hung this entire semester. I hope you have enjoyed it. All right, and good luck on your final.